They can't stop the day we dissect the news. Flipping on the edge, choices to choose. Politics and laughter, a blend that's so real. Tuning for the stories that make you feel. With guests from every angle, let's bridge the divide. Finding the truth in the humor we can't hide.
Yeah, all right.
Okay.
So, Emily, I got a question.
Oh, good.
So you were talking, do you have to do ER rotations? I mean, like if somebody like gets in a fist fight and their jaw's just shattered or car accidents, I never thought about that. You're the one who has to be called in for that?
No, thank God, no. But my oral surgery colleagues, there's in town, I think maybe somewhere between 8 and 10 total oral surgeons that rotate call. I have several oral surgeon friends, but I have my best friend who is an oral surgeon, and I always know when she's on call because she just doesn't respond to text messages quite as quickly because she's not sleeping. I feel like that is a very under-recognized part of their specialty. So oral surgeons, prosthodontists, we work together, but I'm more of the tooth side. So reconstructing, somebody that's been catapulted out of a car and lost all their teeth. But the actual physical bones, like putting them back together and maybe having to go to the OR, that's going to be oral surgery. Sometimes ENT, plastics, there's sometimes a big team that has to be involved there. But they rotate call throughout the city. And I think it's probably the same way in Denver also. So it's a week of lots of fun.
How do you deal with the blood? How do you deal with it?
I don't know. That doesn't bother me.
It doesn't bother
No.
you? Oh, God.
No, I don't. There's not very many things that gross me out.
Like I just had to give like one little vial of blood yesterday.
You passed out.
No, I looked away because I'm like, I just couldn't do it. And even the lady was like, really, you?
Yeah.
Like, 'cause she was like looking at me like, come on, you're supposed to be some big tough guy. I'm like,
Yeah.
no, I'm not.
So occasionally there'll be, it's rare, but every once in a while there'll be something within the ER that, like, I'll get a call on the weekend from usually an oral surgeon that's like, hey, I need to send this person to you Monday. They don't have any teeth, or,
Oh my God. Wow.
can you? If it's something really awful like a suicide attempt that, like they
You have to. That's crazy.
create a hole so they
Yeah.
have a fistula and they cannot eat because it's coming out their nose. So there's different prostheses that we can make on a, sometimes quickly, just temporary, to get something in there while the surgeons decide how they're going to close, the areas. Wow. I was curious when you were talking about open wounds and the device or whatever it's classified as, if that is ever planned to be something that would be utilized intraorally.
That was my thought too.
We have
dental applications.
We have a subset of the population that does not heal. They don't heal in the mouth. It's really bad, like the combination of diabetic, smokers, and then let's say it's a female that maybe took a bisphosphonate and then had to have some dental surgery, or they have a broken jaw or something like that. Sometimes
what's a bisphosphonate? What is
a
that?
Bisphosphonate. So that's a type of medication that has been used, is still being used for osteoporosis.
Oh, okay, I see.
I don't know where those are going to be heading, but there's other medications that can cause the same type of issues with healing.
Like anti-clotting or something?
It has more to do with how bone actually heals.
Oh.
And so those medications are designed to slow down the process of bone breaking down everywhere else in the body, but the same thing happens in the jaws, actually probably at a little bit more accelerated rate. And so when we go in to do something, take a tooth out or put an implant in, we need the same healing. We need normal healing. And if we don't have that, whether it's through vascularity or there's a change in actually how the bone, is regulated because of a medication, it sometimes can be awful. It can be catastrophic. Like they lose an entire jaw. And there's not always a lot that we can do for that. So sometimes those patients, cancer patients who've had radiation, same idea, we'll have them go through hyperbaric oxygen therapy to hopefully help
And that's
know.
similar to what yours does, right? Deliver oxygen?
Yeah, hyperbaric chambers are kind of going through a bit of an evolution as to effectiveness. The concept is, higher pressure, saturated oxygen, etc. It's similar, but the way we do it, like you said, we're just enabling and giving oxygen and moisture to the cells from the outside because they don't have the vascularity yet. Right? Or they don't have granulated tissue yet. They're just trying to heal, but the body can't get any support or nutrients to them. And so the way the product works is it helps those surface conditions do, but you can only really be effective if you have contact. So when you're talking about bone or something, I mean, to get through the flesh and get to the actual bone, I haven't seen any evidence of that yet, although the medical studies we're doing are incredible, that we're learning so much more about nitric oxide and production of the starting points of cell regeneration. So we're just that's the beauty of it, that the effectivity is so good that we're really starting to be able to dig deeper into the areas that it's helping people. So we truly are scratching the surface, which is what makes it such an appealing situation. But it basically, if you can get to the wound, get to the surface after they debride it, we can help it grow back faster. So when you talk about the mouth and whatnot, I mean, the key is it needs to be hydrated, but not wet. We can't have a water layer because oxygen can't permeate water. If you had like droplets all over the wound, that's unacceptable. You have to hydrate and get the cells to open up, right? You come out after a shower, you have a wound, it always looks different, right? Pat dry, it looks good. At that time, it's in perfect condition to accept beneficial treatment. But everybody knows when you have a scab, it's dry, body's protecting itself, nothing's going to penetrate. That's why the body scabs. So our idea is you got to get through that, soften it up, and let the treatment get to it.
Interesting. So you said the effectiveness I think you said the effectiveness of hyperbaric is being, I mean, it's been questioned, I think, in the dental realm for many years. It was more of like a CYA, we put the patients into that because if we didn't, and something didn't go right, should we have done that? But it's expensive. It's not comfortable. It takes forever,
Yeah. It's hard in my industry. Sorry, Erica. It's hard in the industry because you don't ever want to talk bad about other therapies. I'm just saying in comparisons, the hyperbarics at this point, all of the things you mentioned are challenging, difficult, expensive. Effectiveness, a little bit more limited. I think the key is you also end up over treating. I mean, you're putting the entire body in there when you don't need it. So of course, those people who make those devices are going to stand by it. But I think in general, the world's starting to challenge a little bit more. And it was really interesting at the start, but I think they're starting to dig a little deeper. And unfortunately, I don't believe the results are quite there.
Interesting. So how does AI impact or how do you foresee it impacting like what you're going to eventually be doing as an engineer and as a medical professional? I mean,
you want to go first? You want me to go first?
You go.
I know.
I can tell you, it is
for better or for worse or both. Or I mean,
it is. It's always a good bad. I'll take for example CAD-CAM. When I was mentioning, this is 2010 to 2013. In North Carolina, when I was there doing my residency, that was a very progressive program. We had like some of the first scanners, intraoral scanners that were available.
Not the movie scanners where Michael Ironside's head blows up, but actual scanners, right?
What was it called?
CAD-CAM, so computer-aided design or assisted design, computer-aided manufacturing.
Okay.
Interesting.
I mean, it's been around years, but the advancement into dentistry really, it took a big turn. So like developed in like early 80s by a French guy, and then it just stalled. I mean, like you were saying, it takes so long in medicine, and then, who knows, I'm sure there was political reasons too, but it did not really catch on so quickly here until, I don't know, maybe like late 90s. And the very early systems were not very good. So the idea is there's a little wand, you scan somebody's tooth, it goes into a computer program that knows supposedly how a tooth is supposed to be shaped. It spits out a design file, and then you mill, like a machine. That's the CAD part or CAM part. You're going to mill a crown and then put it in someone's mouth. It's just they just didn't fit great. So it's like, what's the point of this? At that time we had dental technicians who could do these things with their eyes closed, and get a much better result. So really that probably all started taking a turn when the changes in classification for a dental lab tech went to unskilled labor.
Oh, interesting.
And I think when you do that, that affects.
Did that just happen in Colorado?
No, this happened 20 years ago.
Oh, okay.
Really?
Yeah. So what you see is programs start to die. So dental technician programs that used to have maybe 20 or 30 individuals graduating a year, just gone. Now I think we have maybe 7 or 8 nationwide. The military still has some programs. They have great programs. But that change basically meant, okay, I can have an unskilled person starting to make crowns. Okay, well, I could hire, the gamer teenager off the couch who's really good with gaming. They think they know what a tooth looks like. They can go for it.
Because they can operate software
with their eyes closed.
really
A, start, select, start,
and they
go.
can fit in chairs just like that.
Just like that. A gamer chair. There it is.
So that then kind of has pushed even further, like the AI component. So now, we don't even have a person designing. I do. In my office, I do. I still have a certified dental technician that designs all of the crowns because I like
because you're old school.
Old
school.
You're kicking it old school.
It's because I feel like that. I do think that the end product is better. I have to be careful what I say here, but so for example, my intraoral scanner now, which is, I think it is the most advanced scanner on the market. I can scan an image super quick. In 30 seconds, I have an image of the tooth. It goes into design software. If I wanted to, I could use an AI program that sends me back a design of the crown in, under 5 minutes. It's it's almost instant. And then send that to the mill or the printer to be printed. However, so the downside of that is I don't love the designs that come back. Sometimes they come back looks like something you would maybe put in Shrek's mouth.
Oh my God.
I'm like,
That's probably not going to fit. It's not going to fit.
And it all has to do with the parameters. It's not the hardware. It's not the scanner. It's the software. It's who's behind that, which are not dentists. Those are software engineers who they're just plugging numbers in. Oh, it's this dimension. We're filling a space. So we fill a space. I was thinking about this morning. Do you remember that scene in Weird Science where they're screwing around on the computer designing their woman?
Yeah.
And they get to the breast part.
Yeah, and it goes and they get big.
Yes, it was that is literally exactly what we do now. And we're filling a space. So it's just kind of the artistic part of it. AI doesn't, I don't think it understands that quite as well.
Yeah.
So there's
it's exponentially probably getting better and better and better.
It is.
More intuitive.
Yeah. Every day, I cannot keep up with the advancements that are coming along. It's actually ridiculous. But, so there is that part of it, good, bad. The other side of it is that, I think we're going to just start seeing this everywhere in medicine. I'll have patients come in and they're like, well, I just asked my phone and it told me what was wrong with my tooth. I'm like, well, what do you need me for? You don't need me to diagnose for you. You've already figured it out. And then, they're designing, here's what I want. Here's what I think I need. And then of course I'm looking at this. I'm like, no, it's not even close. We gotta back up.
And then you get teeth like Post Malone. You get this.
Oh, that's a whole nother.
Yeah.
That's a whole nother.
What has Post Malone got with his teeth?
He's got a grill thing.
Oh yeah, okay.
Is it silver or something?
I can't remember. I think
don't know.
If I remember correctly, this was on another thread that I was reading. Him and one other very
Little
famous
Wayne or whatever.
Yeah, one of those guys. They just did a whole titanium, and I don't know if it's on implants or if it's just cemented over their teeth. Either way, it's
They saw the Terminator.
It's
They
very
just wanted.
expensive.
They just
Yeah.
wanted Terminator teeth. You know, from the Terminator.
Wow.
It looks awful. I mean, it looks awful.
It's rough looking.
It
Yeah.
just
and I think I saw Madonna had something like that too, and I was like, I was like, oh,
Gold?
isn't it a tragedy?
Is it gold?
No, it's platinum. I think it's platinum or
yeah,
something
I think
like
they
that.
were doing it with something with the platinum or the
Something.
platinum palladium alloy or something like that. So
And
I
it-
actually think it's
Yeah.
like a dentist / jeweler because that's.
Diamonds,
I mean, we do have the ability
bling
to
in
probably
your
print
jewels.
but that's just so expensive.
Oh my
I wonder
god!
if you get bad breath with platinum teeth.
Like, what is it like to have that much money?
Yeah,
That's
that
the new
you just-
billionaire
I
status.
think the tricky part I read there, like the tricky part was embedding the diamonds, whatever carat of diamond, into those.
Yeah.
You know, so it is more like a ring, something. It's just like, okay, this is.
and brushing your teeth and flossing. Around.
You don't have to do that anymore. Now you just use a blowtorch or something.
Gross.
Yeah.
Why not just take a diamond and encrust it in something clear, like some kind of hardened epoxy, so that way if you smile, you get a diamond smile with clear teeth and diamonds inside.
That's probably next. That's probably coming.
I should have not said that.
Lucy
that
in
was,
the Sky.
no,
with
bad
Diamonds.
idea. Do not do this.
Do not.
Lucy in the Sky with Diamonds, right?
That's probably coming.
Yeah, I know. It's crazy. How about for you, Chip? Like an AI with engineering, I mean, is it coming for your job? I mean, what do you think?
We've been using it like for documentation more than actual design work. What we found is it can actually be pretty good at getting like a first draft, like a starting point. But what I've noticed with AI is when it's off by a million miles.
I totally agree.
That's the thing.
I totally agree.
It doesn't remove the fact you have to proof it. So, some people at the office are incredibly into the AI concept. Like it was just going to cut down all the time. But as Emily said, engineering is art in its own way. And so if I haven't yet seen an engineering program where you'd say, design me this bolt in smaller size. That's not really that hard. You almost don't need AI. I mean, you can kind of do that yourself extremely quickly. So in documentation and other things, it's starting to get there. But what I found is it's just not trustworthy. It can be a starting point and get you going. But, I've just seen when it goes wrong, it is so far off. It just gets off on these tangents. And you're like, where did this come from? I mean, this is so stupid. It's so foolish. Yeah. And that's the part that you got to be really careful, because if you don't proof it or you tend to lean on it too quickly, it will just go horribly wrong for you.
It hallucinates.
It hallucinates.
Yeah.
That's what they call it. Hallucination.
Yeah, I used it just to play with some creative image generation, and I said, generate two Maltese dogs sitting in a cafe drinking coffee in front of a fireplace. I gave this detailed prompt, specific and detailed prompt, and sitting on a couch in front of a fireplace listening to jazz music, and I wanted to see what it generated, and it had the two white dogs, and it had the two white dogs, but they had ears like a Maltese that go down, and they had spiky ears like a Westie.
Yeah.
They had each four
Mutant ears.
And and it was like disturbing just to see, but
People
it was
have,
a
like, 6
hallucination that
fingers.
it couldn't decide
That's
the
the
proper breed. So it was like, oh no. So it took a few generations, but it eventually had a super cute image with the coffee cup steaming and the fireplace flickering, and it was really good. But it was it took several different prompts.
And it's short, right? It's like a
And
10-second clip or whatever.
Using it for research on my book, I have a program that just helps synthesize research sources, like find me research sources on this topic, and just synthesize the basic ideas so I can go out to the source myself and find out what it's about to make sure if I want to use it or not. And it's hit or miss, because sometimes it will bring in sources that are not really about the topic, and it's not truly understanding, and it'll bring in really abstract things that are so off base and so out there, and I have to really check every single source carefully and go to the original source to make sure I'm drawing what I want. You can't rely on those summaries to be accurate. But it, like Chip said, it's a starting point, and it gives me something to, it cuts down, I would say it definitely cuts down my research if I compare it to research I did 15 years ago for my dissertation. I'm overall pleased with how it's been able to help, but it's certainly not doing the work for me. I mean, I'm still doing the work, but it's a partner. Yeah. It's a partner. It's a research assistant, but it's not doing the work. I'm still doing the work.
That's interesting.
But I did have a question for you when I was thinking about FDA processes, when you were talking about how the slow rate of things and the way that you're, doing testing on your equipment and things. Tell us a little bit about what that process, I think people might be interested in what the process of FDA approval looks like. And the reason I think about this is in my ethical leadership class, the students are doing literature review circles on the case of Theranos and what Theranos went through with trying to get their blood testing machine approved through FDA, and all of the shenanigans that went on with Elizabeth Holmes and Theranos. And I think that in the post-Theranos era, Silicon Valley and other startups are having an even tougher time with FDA approval. And I wonder if you're seeing any of that because you're in that same medical research industry.
Yeah, I think the issue is, like every government regulatory body, is they've got kind of two methods of operation. They can either operate in preventative, where they try and put in such strict rules that they prevent an issue from occurring, or they're punitive, where they kind of let the industry and the marketplace set the acceptance, and if you violate it, they'll come back at you hard. And it's been a big debate because we talk about it all the time. Is it better to have the FDA try and work really hard to prevent anything from getting released that's not appropriate? Or should they put that onus on the company that they get to release it, but make the company so accountable that they do their job right? And that would mean, like, even if the company's sold, whoever was the CEO at the time is held accountable past the transaction of the company, right? Like, if they sold it and then 10 years later they found out, because there's all this immunity that happens, right, with leadership, and people can come develop, make a big splash, a new financial officer will come in and they'll do a bunch of stuff to save the company money, but then in a year and a half you realize they've sold off half their assets and everything's just gone downhill, but they got their huge parachute payment and they're out. And so it's a tough one. The FDA is having to adapt and evolve, because it's horrible if you were to hear that, okay, company A developed a drug. They didn't research that drug in all test cases. It worked for the standard healthy American or, whomever on the planet. But then if it was a pregnant woman or somebody who had diabetes, they had a negative interaction. They didn't take the time to test it with them, right? And so something horrible happens. Well, they could then come back and go after the company and say, you did a completely insufficient job at testing it. Or FDA can say, no, we're going to come in ahead of time, make sure you tested with all these different scenarios. But what if you miss one scenario? Then everybody gets sued because you didn't think about this one complete boundary condition. And it just goes back to, again, the ethics as to how much and what can you put on the company to do the right thing? How do you enforce people to do the right thing? And as we've seen with so many negative cases,
like the Sacklers and Purdue Pharma.
Yeah. The companies that know there are going to be addictive issues with their drugs or other situations, and they just let it go. And they're like, oh, the doctor should catch it. So it's an interesting case. The sad thing is they have class devices, class 1, class 2, class 3, right? We're class 2, but, like an implantable heart valve, it's such a quick scenario. If it doesn't work or just breaks apart, the person's pretty much dead, right? So they don't have time for the FDA to come in after. Longer term medications, you find out, just throughout the 30s, 40s, 50s with asbestos, right? People were putting it everywhere. Then all of a sudden they're like, wait, this isn't it. I mean, but could they have foreseen it? It's a really tough proposition. I think it balances with what the American consumer is willing to tolerate and what they're willing to pay for in their taxes. Okay, I mean, FDA is a nonprofit, right? They're not supposed to be out there generating revenue. So we have to pay for submissions. And they try and do their best. But, I think if we could find a delicate balance where accountability is on the company to do, the level up to what, is deemed reasonable, and then hope that, FDA review and guidelines are enough to kind of catch it if they don't. Because all of the regulatory things they put in ahead of time are so difficult to comply to. And it makes an environment where people are gun shy to make changes to products. Like, you have a medical product, it'd be better if you did this, but you also know if you change this one little item, it's going to cost you 9 months and another submission fee, hundreds of thousands or whatever of dollars. And it's like, you don't want to let a subpar product go out. So then you make your decisions based on patient health and risk. So while it could be 10 times more convenient to the consumer, you won't do it. But if it's patient risk, you do it immediately. Right. And that's the way we've had to operate. If it's a patient risk, you address it immediately. But if it's an enhancement or something that makes it more convenient or could reduce cost, you kind of got to roll that to the future and hope you can slide it in with another development cycle. And, we'd all love to be able to do enhancements every day, but you can't. It's not like software companies or gaming. It's like, we got a patch.
That's just what you made me think of because, that's so interesting. That's just what you made me think of because it really hinders change processes and change management when you have FDA and software and other kinds of development companies don't have that factor that hinders change. And I just got done writing this section in my book on change management and the kind of the evolution of change processes and disruption, and looking at how disruption is so prevalent that change is almost constant now. That change needs to be responsive and constant now in organizations, but in your field, it's hindered by this process. And I didn't really think about it like that because I'm looking at specifically the model of like the agile model and Scrum and all that. And I'm writing about all that. And I'm like, oh my God, this is in project
Scrum.
Management. So I have a whole section addressing project management and agile and Scrum and what that all means in terms of, being responsive to change in a way, because I have it in with change management models and just with disruptive industry, with the disruption, and you situating that within this idea that you're almost tethered in a way from being able to be responsive. That is difficult.
But it's because of an ethical consideration.
Yeah.
So it's a tough call. That's what Chip is saying.
I know, but it's
ethical and regulatory,
yeah.
right?
Because could you imagine if you didn't have any if it's just like Sierra Leone or something, you're going to have a lot of change. It's going to be like really quick.
Yeah, of course that wouldn't work, but you'd have, the model to which that one is that there's incredible penalties and there's no hiding from them. That'd be the only scenario it works. Okay, so medical company A skips a bunch of their steps and they go out and really bad things happen while all the executives are held accountable regardless of where they're at in their career and where they've gone. That would make you be a lot more protective to be able to say, I'm going to make sure my paperwork's in a row and I'm in a good place. Because if I know if I retire or I go away, I don't get to hide from it, or, they get their huge parachute payment and they're out, who do they blame? Right? It's like, all right, new CEO. So then, it really comes down to accountability and how long you're going to hold people accountable. And FDA is basically trying to regulate in ethics. And you're never going to catch every scenario. And it's, that delicate balance. So we have this discussion all the time. Is it better to hold them accountable after? And of course, people will get hurt if you wait till after the fact. Yeah. But if you miss one and there is no accountability because, hey, FDA approved it, you can't sue us, right? So other people get hurt with it because the FDA approved, that then makes the FDA try to go to every single detail to make sure it's perfect, and they can't. And so is it better to make sure you hold accountability, or is it better to have somebody to blame? And right now the environment is somebody to blame. And when that's the case, they've got to do their very best. And they're not staffed for it, and American taxpayers don't want to pay for it. And business like ourselves, we can't necessarily afford every time we go to the FDA to talk to them that they're going to charge 7 figures to speak to them.
Wow.
Which they don't. It's not that expensive.
What's the average cost? I mean, for a submission when you turn in a...
Yeah, so to file a 510K, I really don't know what the filing fee is. We're under the small business disclaimer, and so there's that different. Like if Johnson & Johnson goes, when they put in an application, it's different versus what a small business does. I'm sorry, I don't remember it.
Okay.
It can be hundreds of millions, I think.
Well, for the big companies doing a major drug study, but no, I mean, so when you think about the cost of submission, you got to think about all the testing and the background work. I mean, that's hundreds of thousands, right? But to actually just give the paperwork to the FDA, for us in a small business environment, I'm not even sure. I don't want to take a guess. But I think it's less than 30, maybe 7.5, 30,000. It's not terrible, but it's all the testing documentation, the work you have to put in to get there. So it's not just the filing of the paperwork, it's all the background information.
We could put a link in the bottom of the comment section too, where there's information.
Yeah, like I said, under small business designation versus larger, and the type of class 2 versus a class 1 or a class 3. So there's a lot of factors that go in.
And then speaking of small business, so Emily, I mean, you are the definition of a small business. I mean, it's you and a handful of your crew, right? And that's kind of like what I learned with Pop here. I learned with years just operating with a crew of 4 or 5 guys, kind of a thing. Chip, you've worked for gigantic corporations, right? Baxter.
Yeah, Baxter is
Would you,
significant.
That's international. Is that a global or multinational?
Yeah, Baxter International.
Yeah.
Like tens of thousands, hundreds of thousands of employees, kind of stuff. What do you think? I mean, is the era of a gigantic corporation going to be coming to an end? Do you think? I mean, I don't see that happening.
No, I think
Amazon's going to be gone next week. Sell your stock.
I'm
please.
just saying, in the medical field, is there this?
We're going to be multi-planetary organizations now.
No, it's an interesting discussion.
Admar, I threw that in for you.
Thank you.
In the last 5 years since COVID, there's been a huge consolidation of dental practices with it's called a DSO model, a dental service organization. There are several hundred very big ones that come in and buy a practice, and then does it
stay good, or does it kind of drop off when that happens? Their quality, it drops off. I'll say it. It drops off.
I don't want to. It depends. It really depends on the scenario and who's there and who's behind it. I mean, there are some benefits with a DSO. You can get your supplies cheaper. A lot of them have a consolidated attorney network. So, you have an issue, you just call one of their attorneys.
Insurance rates go down.
Yeah.
That is probably state dependent, but possibly. Yeah. So there's some other, they may be able to get group benefit insurance.
Yeah.
For all the employees. Okay. There is a plus. I think it's a little bit shifty when they say, we give a stock option to employees and staff. Because what do you buy? It isn't like Amazon. You're okay, I'm buying stock in.
I'm buying a grill for my teeth.
Yeah. So I mean,
it's medical still. It's medical, so it's.
But it's not really.
But it's not medical.
No,
they're blurring the line between medical and free market.
It's not like they're working for Microsoft and then you give Microsoft stock to employees or something like that. But they're trying to make it look that way. But that stock is only going to be as valuable as the company. So, I mean, a lot of private equity and venture capitals come into this space because, somebody's going to invest a couple $100,000 and they're going to be sort of promised and maybe 8 to 10% return in X number of years. But how are you going to get there? Well, there's only a couple of ways. You have to have your widgets, your dentists and your staff doing either more procedures, which comes into question the ethics of it. What procedures are we really doing?
Yeah.
Are they really needed? Can they charge more? You can try, but if it's something that's limited by an insurance, like in a network plan, you can only charge so much. So it usually ends up being a higher volume. So, okay, I used to see, I mean, I'll just say, for example, if I were in one of these situations, it'd be like, okay, I used to see 10 patients a day and now I have to see 40. I mean,
That's why I said like
really
the
make
quality.
the numbers.
How
Yeah.
could the quality maintain then if it's
Me personally, I don't think I could do it. I mean, I
Yeah.
physically don't think I could see 4 times the number of people a day
Right.
and actually do what I needed to do.
Yeah.
It would, I would need, I don't know, I would need AI miracle work to be able to do that, to physically sit down and work and do something that I had to do. So so when you're talking, small business versus large corporation, I don't think that they, there's still going to be a need for a small business, like dental idea. I mean, I can still operate fairly well. Regulations have gotten a little bit out of control. I'm just gonna say it. It's just gotten ridiculous with some of the regulations, especially in the state. But the larger landscape with dental corporations is not going to go away for a while, but I think their value is going to eventually decrease. There's only so many dentists that can
work at like, what is it, Comfort Dental or whatever. That's
and that's why I say I have to be
model,
careful because they're all little different models and they're not bad. There are good people there and they're trying to do good things.
Right.
But they have a higher.
In my mind, it's almost like going to like a steakhouse or something that's like owned by a family. Like they let like their recipe, and it's kind of like like it's like the greatest steak you ever had, versus just going to like Sizzler. Or Golden Corral.
I don't know if I would want to compare it
Amazing.
to steaks to beef, but they're just as like it is a difference of like a
the
commodity.
McDonald's
exactly.
of dentistry or whatever.
Yeah, and the price that we put on that. It is kind of sad. Like you can go to another country and get some of the same procedures done.
Yeah.
I can't speak to the quality because they don't have the same standards that we do. Sometimes that's good, sometimes that's bad, but I've had patients go to other countries that it doesn't look terrible. It's worked out. I've also had complete disasters and we have to start all over and it's awful. But they're like, but I only paid, $5,000 for it. I'm like, that's all right. Now you have to pay $80,000 because we have to start all over.
Yeah.
80,000.
Well, I know when you were, I think you were in Pueblo, and I was going to use an in-network dentist with my plan, and the person was near the house. I'm not going to name anyone or give any hints, but that I just tried this person one time, and they came back with tons of things I needed to have done. And I was like, oh my gosh, I can't believe this. And then I brought it to you, and you're like, you don't need any of these things. You're fine. And I was so worried, like, oh my gosh, my teeth are a mess. And you said, you don't need any of this.
Yeah, that's why I say I have to be careful, like what I say about.
I know.
But that is not.
But I was
Lawsuits.
convinced I had serious problems.
We have a
with my
disclaimer
teeth.
on this show right at the beginning.
No,
This is just our
I
opinions.
see that every day.
And I was so relieved, but I was seriously, and so I just, ever since then, I was really cautious, about
hopefully, I'm hoping that the general public questions what and they should even question me, like, okay, she recommends this, why does she recommend this? And
even question you.
well, like, we're all known to make mistakes, it happens, or maybe I see something or I don't see something, or have me look at it again, or is there a different way to approach the scenario, but it is unfortunately like it's every day. But
So
that's
interesting.
I mean, have to be very careful what I say here. Probably the most common over-diagnosis that I see now is periodontal disease. And I'm not a periodontist, but I can diagnose periodontal disease. And I have patients come in all the time. They're like, I was told I need deep cleanings. And doesn't a deep cleaning sound great? Like my house,
like
deep
your
cleaning.
rugs or whatever.
Yeah.
Well, it's not great. I'm sorry, it's not. That means you have to be numbed everywhere, theoretically.
Ow.
For it to be a true deep cleaning, effective, it has to be underneath the gum tissue. There's got to be reasons why we're doing that, and it's not because somebody just poked you with an instrument and drew blood. That's not a diagnosis. So that's the number one thing that I see. Again, I have to be careful because that is a very easy way for a dental office to, they can collect $600 to $800 very easily just by a deep cleaning.
Right.
I'm like, okay, we didn't really need to do that.
Like advanced gingivitis or
Yeah, there's other codes that can be used. There's different, it can just be a little bit more of a cleaning. We call that like a scaling in the presence of inflammation. Okay, it's a little bit more of a cleaning, then you do a second appointment, but it doesn't put you in the diagnosis category of periodontal disease because that's a forever. That doesn't ever go away. And that's the part, that'd be like in the medical world, getting a diagnosis of diabetes. Oh, is it reversible? Well, yes, but I think once you have that diagnosis, an insurance company always is like, oh, there's a flag.
Diabetic, yeah.
Yep, there's a flag here. There's a red flag. Okay, we don't know where this person's going to, So I just think it comes with a lot of unknowns, in doing that, just because someone's like, okay, I need to produce an extra $800 today. So we're going to diagnose this on, X number of people because their insurance covers it.
Interesting.
So getting like a second opinion is always something you would recommend no matter what.
Yep. I even tell people that come to me that are train wrecks where I'm like, holy crap, we got to do a whole bunch here. Because most of the time they see how much it's going to cost and they pass out. So we wake them up. and then they start crying. So I give them a box of Kleenex.
They start crying. Oh my God. Well, yeah.
Join us on this path, let's ignite the blaze. So grab your headphones tight, let's go for a ride. With every spin and twist, we'll cut and run and hide. The Prime Directive where the laughter's alive. Society's reflections, let's help each other thrive. Politics and culture, oh what a blend. Join on the journey and let's set the trend. As we close the chapter, lend us your ear. The Prime Directive's calling, so let's pass that beer. The Prime Directive where the laughter's alive. Society's reflections, let's help each other thrive. Politics and culture.